Hi, my name is Jasmine, and we're going to be performing a dressing change. Okay, so first I'm going to look at my MD's orders, perform some hand hygiene. I'm now going to introduce myself to the patient and the family, identify the patient with two identifiers. I want to look at the wristband, ask the patient, say their name and date of birth, and verify what them are. Apply PPE if needed, gown, mask, eyewear, gloves. And then I'm going to, and if there was for a risk of spray or anything like that, then I'm going to position the patient into a comfortable position. I'm next going to grab my gloves. I have them all to the side here. I'm going to do some non-disposal ones first. All right, looks like a little something on my glove. I'm going to pretend like there's nothing on these gloves. Okay, so after that, I'm going to look at my patient. Can I see your arm, please? All right, so we're going to pretend that there's a dressing already over here. So I'll remove the dressing one layer at a time. I would check for any drainage, exodus, swelling, redness, things of that nature. I would then take off these gloves. I have a biohazard bag already here that's cuffed. Take those off, perform some hand hygiene, put on sterile gloves. My sterile gloves are right here. So since I'm left-handed, I'm going to start with my left one first. Get my fingers in correctly, that'd be okay. Grab my right one. All right, I got this all kind of twisted up in here, so I'm gonna get that together. Okay, so now that we're all good there, okay, so now that we're all good there, I am now going to clean my wound, starting from the greater to the least contamination, going like this. So after I've done that, I would use any ointment or any cleaning solution if needed, and I would apply that to the skin. After that, I would take a piece of gauze. And we're doing a dry dressing first. And I would place it. Using as many as I need. I'm just gonna do 2 for now. Now I have some tape here. And I would, after that, I'm just gonna sit my tape. Just wanna get that piece started. Sometimes it's hard to start tape. I will get an ABD pad. That's bigger than the areas. That's bigger than the gauze area. And I would place that here. Whoa. Make sure nothing happens. I would get some tape. And I would now apply tape to my ABD pad. And I will have applied a dry dressing. I'll go all around to make sure that this is secured, but just for temporary purposes now. Now I will go back and show you how to do a wet to dry dressing. So wet to dry dressing, same thing, verify my patient, things like that. I'm gonna assess the patient's pain to see if there's any pain involved. I'm now going to remove this one layer at a time. Moving the AD pad first. Disregarding that into my biohazard bag. It's right here and it's already cuffed. I'm next going to remove my gauze one layer at a time. Look at my wound, assess for drainage, exodus, swelling, anything like that. Clean my wound if needed. From the greater to the least contamination. Okay. I have some solution here. So first, I would just pour a little bit of it in my container. Yeah. I would have put on new gloves and things like that as well, but I'm gonna try to get this open. So after you use Cestune, I would put on new gloves and then come back, perform hand hygiene, put on sterile gloves. I'm just gonna pour a little bit in there. So with the dry dressing first, I'm gonna take a piece of gauze, fold it if I need to or things like that. Dip it in the saline. I'm gonna wring a little bit of it out. And you can use as much gauze if needed. I'm just gonna pack my wound. So after I did one, I'm gonna come back, take a dry gauze, excuse me, place it on top. Same thing again. Like I said, you use as much as needed. Wet, dry. Then after I've done that, take an ABD pad, a clean one, and then I would apply it like so. And I would tape it to secure it and things of that nature. After I've done that, I would now clean my area, make sure the patient's comfortable, ask the patient if they need anything, remove gloves, perform hand hygiene, and document.